Now we'll see that, or we'll have an idea about the parathyroids. Parathyroid glands. You two left and two right. They locate behind the thyroid. All these, the cells in all these four glands, they produce hormone called parathyroid hormone. The parathyroid hormone functions on bone and on the kidneys. When plasma calcium level is low, parathyroid glands are stimulated. They release parathyroid hormone. Parathyroid hormone functions on the bones to increase the resorption, to release the calcium into the plasma, and also parathyroid hormone functions on the kidney. On the kidney to produce vitamin D or hormone D. This hormone D, one derivative, affects the intestines to increase calcium absorption, and also PTH directly affects the kidneys to decrease phosphate reabsorption and to increase the calcium reabsorption. At the end, plasma calcium level is increased under the effect of PTH, and plasma phosphate level is decreased under the effect of PTH on the kidney tubules. Also important in the regulation of calcium. Hormone D or vitamin D. We call it hormone because it's produced in the body and released into the blood. And also we call it vitamin because we can take it from the food. Either vitamin D or hormone D, both terms are right. Vitamin D, two types. Either produced from the skin under the effect of the sun. From the skin, this hormone D is called D3, cholecalciferol, or when vitamin D or hormone D taken from the diet, ergosterol or ergocalciferol or D2. And then you see vitamin D or hormone D, two types, either D2 from the diet or D3 from the skin. Both are transferred into the liver. In the liver, metabolized, they produce 25 derivative. 25 derivative. This derivative transferred into kidneys. In need, they produce this 25. In need produces 125 derivative under the effect of these factors. If there is vitamin D deficiency, or calcium deficiency, or phosphate deficiency, or parathyroid, 125 is produced. But when there is no need, 24-25 is produced. When there is a lot of 125, or calcium excess, or phosphate excess. These three derivatives are these three derivatives, they function in the body. But the most potent 125, then comes second 24-25, then 25. These 1, 2, 3, they circulate bound with the proteins in the blood. And these three they function in the body. The most potent is 125, then 24, 25, then 25. Then vitamin D is processed first in the liver, then in the kidney. This is the function of vitamin D. We said that the most potent, the strongest is 125. When plasma calcium level decreases, you see, similar to the PTH. Plasma PTH increases, renal enzyme activity increases, this one alpha hydroxylase, 125 production is increased, plasma level of 125 increases. This derivative of 125 functions on the bone similar to the PTH. This derivative of vitamin D or hormone D functions on the intestines to increase calcium absorption and also to increase phosphate absorption. And also this derivative functions on the kidney to increase calcium reabsorption and phosphate reabsorption. You see, vitamin D increases both plasma calcium level and also plasma phosphate level. You understand that vitamin D is responsible for the mineralization of the new bones or of the bones. Then vitamin D and PTH both they increase plasma calcium level. But vitamin D, instead of decreasing plasma phosphate level, increase plasma phosphate level. Therefore, vitamin D responsible for the mineralization of the new bones, especially in the body. While we are talking about the calcium and vitamin D and parathyroid hormone, let us have an idea about the functions of calcium in the body. I'm sure you know all the functions of the calcium in the body. You know all these, just they are gathered together. First, required for the mechanism of normal sodium permeability in nerves. You remember calcium responsible for the sodium permeability in nerves. And you remember the release of acetylcholine. It needs the calcium. It is involved in triggering the release of acetylcholine from nerve endings at neuromuscular junction. And also calcium is needed for the excitation contraction coupling in the muscles. And also calcium serves as intracellular signal for some hormone. 5, required by some enzymes for normal activity. And also required for blood clotting to occur normally. You remember if we remove calcium from the blood, blood does not clot. Also required for protein synthesis and constituent of the bone. And these are the functions of the calcium in the body. All of them are important. You see, 99% of your calcium is in your bone. You see, 99% of your calcium is in your bone. While phosphate, 85. Carbonate, 80. Magnesium, 50. Sodium, 35. And water, 9. Then, this is the major inorganic constituents of the bone. This table shows the distribution of calcium in normal human plasma, either diffusible or non-diffusible. diffusible ionized, this calcium stimulates PTH and vitamin D, or complex to HCO3 or citrate. Non-diffusible bound to proteins, albumin or globulin. Total plasma calcium 2.5. Ionized calcium concentration depends on blood PTH. Alkalosis increases protein blood calcium level and decreases the ionized calcium level, whereas acidosis has the opposite. Then pH affects the blood calcium level by affecting binding of calcium to the proteins. You remember the calcitonin produced by the parafollicular cells in the thyroid gland. Plasma calcium level increases, parafollicular cells production of calcitonin increases, plasma calcitonin high in plasma calcitonin decrease bone resorption and also increase urinary excretion of calcium and also increase urinary excretion of phosphate. As a result, decrease plasma calcium level and also decrease plasma phosphate level. This figure shows the effect of calcitonin on calcium and phosphate, opposite of the PTH and vitamin D, as far as the calcium is concerned. Just to have an idea about the selected disorders of calcium. Summary of parathyroid gland hormone principal actions. You see, hypoparathyroidism results in tetany. You know the plasma calcium level concentration from 9 to 11 milligram per dl of the plasma or serum, plasma let us say. But hyperparathyroidism produces osteitis fibrosa cystica, softening of the bones. Then hypo produces tetany and hyper produces osteitis fibrosa cystica, just to have an idea. Of course, severe tetany causes death, as well as severe osteitis fibrosa cystica also produces death. Let us have an idea about the rickets. Rickets occur mainly in children as a result of calcium or phosphate deficiency in the extracellular fluid volume. Rickets is due to lack of vitamin D rather than dietary lack of calcium or phosphate. Children who remain indoors through the winter in general do not receive adequate quantities of vitamin D without some supplementary therapy in the diet. Rickets tend to occur especially in the spring months because vitamin D formed during the preceding summer is stored in the liver and is still available for the use during the early winter months. Then rickets due to the lack of vitamin D rather than dietary lack of calcium or phosphate. This rickets occurs in the children, but there is adult rickets. Osteomalacia is rickets in the adults and frequently called adult rickets. Normal adults rarely have serious dietary deficiency of vitamin D or calcium because large quantities of calcium are not needed for bone growth as in children. However, serious deficiency of both vitamin D and calcium occasionally occurs as a result of steatorrhea, failure to absorb fat. For vitamin D is fat soluble and calcium tends to form insoluble soaps with fat. Consequently, in steatorrhea, both vitamin D and calcium tend to pass into feces because there is no time for the absorption, and vitamin D and calcium excreted with the fat in the stool, and this causes adult rickets. This osteoporosis is the most common of all bone diseases in adults, and especially in old age. It's different disease from osteomalacia and rickets. It results from diminished organic matrix rather than abnormal bone calcification. This is the osteoporosis. This is the most common on old age, especially in women after menopause. 90% of the patients are women and 10% are men, especially old age. This does not mean that osteoporosis doesn't occur in the young ages in both male and female. But these females or males are lazy. They don't have activity. Therefore, they are exposed to osteoporosis. Now we see the causes of osteoporosis. First, lack of physical stress on the bones because of the inactivity. Malnutrition to the extent that sufficient protein matrix cannot be formed. Lack of vitamin C. You see, vitamin C is very important in every process in the body, even in the causes of osteoporosis. Postmenopausal lack of estrogen secretion. Old age in which many of the protein anabolic functions are poor. The others are pathological, Cushing syndrome, acromegaly. And you just, now we had an idea about the acromegaly, excess secretion of the growth hormone. You see, these are the causes of the osteoporosis, especially in the old age, especially in the women. Old age in which many of the protein metabolic activity are poor. Just one point I have to tell you about those women, they have menopause after age 55 or something like this. When the ovaries stop functioning, production of estrogen and progesterone, these women, they have to take vitamin D and calcium and estrogens, but under the supervision of the physician, so as to avoid the osteoporosis. Anyway, this figure shows the location of the adrenal glands. You see, adrenal glands, two glands above the kidneys, or suprarenal gland. One left and one right, above the kidneys, the adrenal glands. Each adrenal gland is composed of two parts, similar to the pituitary. Adrenal cortex and adrenal medulla. Adrenal cortex 80%, adrenal medulla 20%. This is the section from the adrenal gland. Adrenal gland produces catecholamines, adrenaline, noradrenaline, and dopamine. But the adrenal cortex is composed of 3 zones. First zone, glomerulosa, glomerulosa, first zone. This zone produces hormones, collectively called mineralocorticoids. The most potent hormone of this hormone, mineralocorticoids, is the aldosterone. The second zone, fasciculata, this zone produces hormones collectively called glucocorticoids, mainly cortisol. And the third zone, reticularis, produces estrogens and androgens, or gonadocorticoids. You see, from the names you understand that these hormones, they affect the mineralocorticoids, they affect the mineral metabolism, sodium, calcium, etc., chloride. And from the name glucocorticoids, mainly cortisol, these hormones, they affect glucose metabolism. And gonadocorticoids, estrogens and androgens. And then you see these hormones, the mineral corticoids, they affect the minerals, mainly sodium, chloride, etc. These hormones, they affect the volume of the fluid in the body as well as blood volume, therefore affect the blood pressure. Now we will have an idea. About the cortisol and similar hormones, they affect the glucose metabolism. They produce usually the glucose from non-carbohydrate sources. Just to have an idea about the production of or the role of aldosterone, because this is very important. You see decrease in blood volume, decrease in blood pressure, cells in the kidneys are affected. They release hormone called renin. This renin affects angiotensinogen, this protein from the liver, to produce angiotensin 1. Then angiotensin 1 produces angiotensin 2 under the effect of enzymes from the lungs. Angiotensin 2, it stimulates the adrenal cortex to increase the secretion of aldosterone. Aldosterone affects the kidneys to increase sodium and water reabsorption and increase potassium secretion in the urine. You see the role of aldosterone and the role of angiotensin 2 on the level of the sodium in the blood. Both angiotensin 2 and aldosterone, they affect the level of the sodium because both they have direct effect on the blood pressure. Is a manipulation of the level of this angiotensin 2 and or aldosterone, it will affect the blood pressure by affecting the sodium concentration in the blood.